Sure if I ended this, but good morning. Nice to see everybody in person. Welcome to Chicago and the Drake. This is my first NCHL event, so I'm super excited to see you all. And for those of you who have been here before, hear the excitement, and for those newcomers too, as well. I get to experience this for the first time with you all. So thanks for making time for the pre-conference sessions. We've got two today. We're going to start off with our Bridging Academia to Industry Lens Council, and then followed by our Competence and Model Focus Group. So for today, I'm really delighted to have some industry experts come and join us and facilitate and lead the conversation. Just some kind of housekeeping items. It is recorded. We've got just a couple of folks on Zoom. And if you're on Zoom and you wanted to talk, you would just need to unmute yourself and speak up. But just with kind of the weather and travel and things that were going on, we had some folks who couldn't make it. But without further ado, I wanted to hand it over actually to our chair, Mr. Kevin Boom. For some opening remarks.
Well, I guess they maybe. Morning, everyone. Thanks for this time and the effort with being able to get here to Chicago for those who are not already in the area. I'm Kevin Broom. I'm the co-chair of the group with Michael Richards from from Cornell University. And I just want to welcome everyone. Thanks. Thank everyone for their participation. The prospectus for the next year for this Lens group is out there on the street. If you haven't seen it already, look at it and see if there are any questions that you have and reach out to us and let us know any questions you might have. I know from the academic side, the one thing that we're looking forward to for this next year is trying to find some sort of a way for the academic and the industry sides to be able to collaborate, to be able to solve some sort of pressing problem or issue that the industry may be having that where academia may be of help with them. So that's kind of the key thing that we're looking for this year. But otherwise, I will hand it back over and we will get moving.
So this year, I started with NCHL in June of this year. And actually on day 2, I got to meet Kevin and Michael for my first council meeting. So this council is very near and dear to my heart. And we had a great summer. There was lots of great discussions within this council and some questions that led to some research, surprise, surprise. So we sent out a survey to understand what the Lens priorities were as a whole, so for all of our Lens members. And there were some things that kind of bubbled up to the top, which we shared back with you all, but just to kind of prime for the discussion, some things that kept our industry leaders up at night and our academic folks as well is digital health and AI fluency, also funding and grants and the revenue stream for to be able to do the work that we do, and then also optimizing operations as well. So those are some things that were top of mind, and it kind of primed for this discussion. I reached out to Jeanne Armentrout and Jeannine Phillips as well. I want to give an introduction here. Jeanne is our NCHL board member. Is that home? Is it someone? Is it someone on Zoom who needs to speak, or is it us who's making all this happen? Maybe testing mic. That's what we got her going. Oh, yeah. It might be in the ballroom. Thank you. This is sort of like a dress rehearsal. But I want to welcome Jeanne Armentrout. She's a well-respected healthcare leader, former executive vice president of Carilion Clinic, and chief administrative officer as well, and current NCHL board member to lead our discussion, accompanied by Jeannine Phillips of Northwell. And Jeannine leads the organizational development work for Northwell in New York for both physician leadership as well as clinical and non-clinical stuff. So with their combined perspective and experience, we wanted to just open up the discussion for what's top of mind for you today, and just welcome really a lot of great dialogue. We'll be finishing up at 9:15. Thank you. I'll hand it over to you. Thank you. Go ahead. Yeah, Jeannie, if you'd like to start.
See how this works. Hopefully it won't be too noisy. Well, good morning. Really glad to be here, and thanks to Christine for inviting us. Long career in healthcare, and I started my career as an RN. So I tell you that because healthcare is not all about RNs, although many times that's what people make it about, right? It's like a small city, and we have every skill set and every need that you can possibly imagine. And throughout my career, we really walked with our academic partners sort of in parallel, but not linked. And I think it's the time for really a lot of linkage. There's so much opportunity here. We have 4 or 5 universities within about 45 minutes of our headquarters, and we were not really paying attention to what they could do for us and what they can offer. And you guys, I mean, you have so much here, and what we face and what we need. Everything from you're currently providing our workforce, but you have to be ahead of the curve, right? Because our workforce now is using Chat GPT and everything else, AI, all kinds of AI and so forth. We started working on translating our competencies for our staff back to our academic partners, so that when you were working with students, you were teaching them the competencies that they needed to come on board with us, so that their orientation wasn't so heavy and just took too much time. But I'll name a couple things. One, I think you all are in the best position to teach healthcare staff the skills they need from all different perspectives. Anything new, you're already on the cutting edge. Like, you've had to deal with building rules and structure around using things like Chat GPT for students, right? So that there's not plagiarism and whatever else. And so just think about this, we don't know how to use it. You're in the forefront. You could teach healthcare leaders how to use these tools. So you have value there. You have value in teaching us leadership skills. The health systems spend a lot of money on continuing education, and I'm not sure that's going to change a lot, but really you're in the best position to provide those kind of classes and courses and skill sets that we need. So I'll just say a couple more things and turn it over to Jeannine. I think we need to partner more consistently. And I'll give you an example. Before I left, we were working on how our purchase services could purchase equipment for our academic partners, so that you would have the latest in the equipment we're using in healthcare to teach your students from. So they weren't using, old equipment and out-of-date kind of products. We were also having our academic partners help us with research. So as an example, we had many clinicians want to invent things, but they don't know really how to get through the testing and the research on them. And you guys have that, under your belt. So we had an employee who developed lymphedema sleeve that actually does automatic compression for lymphedema breast cancer patients, as an example, but really didn't know how to get through the process of testing and patent and all the things that you guys do every day. And we also were asking our academic partners to help us with ongoing courses and classes to help all of our staff. And in particular, areas like IT, we had a lot of needs for technology employees. So again, it wasn't just about clinical, it's about our small city and all the skill sets that we need.
Thank you. So my name is Jeannine Phillips. I'm Director for Learning and Organizational Development at Northwell. So I think we have a very unique situation at Northwell where we partner very closely with Hofstra University, which is in very close proximity to us. And there is a medical school, so the Zucker School of Medicine, as well as a School of Advanced Nursing and Physician Assistant Studies. And so I think through that partnership, it really allows us to collaborate with their administration, our administration, and just really look at how what we do complements one another. And a big part of that is through simulation. So I work at our Center for Learning and Innovation, which is like corporate university. And so everything that is done at, we call it CLI, is formative. And so it is all to really just help people to gain more self-awareness using appreciative inquiry, offering people real skills and ability to practice those skills and get some, safe environments to get feedback with really expert facilitators and debriefers and learning specialists. So I think one of the things I would like to just impress upon this group is I think navigating complexity and navigating uncertainty is really, really important. And I feel like we have kind of a success story of the bridge between academia and industry right here. This is Lindsay Tiedemann, and she actually spent a year with us as an intern. She was an industrial and organizational psychology intern. She came in and she just had this wonderful ability to understand the big picture, see how our organization worked. She was able to absorb it very quickly, take the complexity and distill it in very meaningful and structured ways to create frameworks for us and help to kind of, put on paper things that a lot of diverse, areas were speaking of. And so I think, that also, led us to hire her in a full-time position. Because I think when people come in with that ability to be open-minded, to really get to meet people, partner with them, learn from them, but also, share, ask questions and not feel shy for asking questions. And so I think that's really important. One of the things, so I think adaptability and resilience are just really, really critical. We recently went through a large digital infrastructure project at Northwell, implementing a brand new EMR. And so, that a lot of more individuals would have been here from Northwell were it not for that just launching within the past couple of weeks. And so I think that, the ability to, come in, and a lot of individuals who joined from other health systems, were saying like, oh, I have experience with this, with that EMR. And so, leveraging them, regardless of their total amount of experience, leveraging the experience that they did have with using an EMR. So, kind of being very open-minded and fostering collaboration, relationship building, emotional intelligence, to really cross-train, cross-function, and promote interprofessional, partnership and collaboration. But happy to take whatever is top of mind for you and what questions you might have.
Thank you. Thank you both for kicking off the discussion and sharing what's top of mind for you and what you're working on and why you're working on them and why it's important. We have a couple other industry folks in the room. I'm not sure if there's anything that you'd like to add or if there's anything else that you've heard. Okay.
Hi. Hello, everybody. Good morning. I'm Jess Weekly. I am the Senior Director of Learning and Development with UPMC. which is interesting. We started as the University of Pittsburgh Medical Center. That's still what the acronym technically stands for, but we're known as UPMC because our academic affiliations have continued to grow and expand beyond the partnership with the University of Pittsburgh. And so I think some of the same thoughts that Jeannine has shared, we sit in a similar space in our organizations. And a few, I've been really interested over the last couple of weeks. We've done some targeted nurse leader development. I know, RNs are not everything. I think we've got some really, really great plans and programs in place for pipelining. But what I was really shocked to hear in a number of these more intimate settings with these nurse leaders who are high potential, high performing leaders is we would have them get up and do a brief introduction, and each of them, I would say at least 80%, said, I never wanted to be a leader. And somebody tapped me because I was great at what I did, but the preparation for leadership alongside the development of those clinical skills, I think is where folks like Jeannine and Marielle and I, when they come to us, it's almost too late to help to prepare them to how do we create more of that desire to be a leader? Because they're great leaders. They've figured it out. But how do we start that preparation even earlier and maybe even more of a hunger for it? And so that we can support those leaders in the right way and focus on those skills. And then I think the other thing that we're navigating a lot, of course, is workforce development and looking more at some of the kind of ancillary services, those skills outside of nursing, and looking at our own maybe limitations of using tuition benefit or tuition assistance. If it's not through an accredited university, an employee can't necessarily use their tuition benefit to pursue a certification or something that might build some of those skills to get them into another role within the organization. And so I think we've been talking a lot about that, how it happens in pockets. We've got geographic spread all over Pennsylvania, into Maryland, into New York, but it happens in pockets, but creating, I think, more connection with our academic partners to really figure out the easiest ways to work together to advance those skills in our organization. Would you add anything to that or no? Thank you so much. Yeah.
Just to kind of tag onto that, I think I'm good. I'll project. I was in theater. Whenever I was at St. Louis University, we had a collaboration with the Mercy Health System that basically addressed some of the issues, what you're talking about, to where that they had people that they had identified that they were grooming to move into leadership positions, but how do they get them some business knowledge and some leadership skills before they stepped into a position where they needed it? And they actually, we had a collaboration to where that you had an academic partner and someone from the organization would teach different contexts to the people. It was spread out over a year. It was like one Saturday this month, another Saturday the next month. And so it didn't impact the patient care mission. And it was more of an ongoing, longer term thing. But like we would have a marketing faculty member pair up with their VP of marketing, and they would teach marketing to nurses and physicians and administrators that wanted to move from being just from being in an administrative role to being an administrative leader. And the bridge was that if they wanted to take that experience when they were done with it, they could convert it into credits to pursue either a degree or a certificate of some sort. And so those type of things actually exist out there. It's just a matter of finding the right partners and be able to talk with them and structure them in a way that the healthcare delivery organization, it works for them, but yet it meets with the needs for the academic institution. But there are models out there to be able to help those type of things.
Yeah, we did something very similar when I was at University of Memphis with the Baptist Health System, where it was about a year-long program that people of different, departments and areas went through. Another thing is, with our MSHA, which is our hybrid executive format, we started going into the hospitals and health systems to ask leaders to identify people who they want to develop. and to encourage them to apply to, our master's program in order to get that sort of leadership training. Since it's a hybrid program and there's only 9 days on campus each semester, then, it doesn't really impact patient care either. And so anyway, we'll see how that goes this year, I guess.
How many folks did you know would?
We just started these recruiting efforts,
Okay.
so yeah, we'll know next year. I'll be able to tell you then.
Okay, yeah, that's the same sort of thing we're trying to do with UNC.
Yeah.
I know back with Mercy, it was about 25 people a cohort, and they had multiple cohorts going through in different communities because Mercy had different footprints. And so we would, focus on one community, then go to another, then go to another, then we'd come back where we start, and we would do kind of a circuit through all of them. And as they progressed through it, they worked together in teams and they developed a project that they pitched to their leadership, some sort of investment idea for the organization. And that way the organization, not only did they get training out of it, they got ideas generated out of it that they could potentially pursue.
Yeah, I wanted to also add, just piggybacking off of that, is that we've had a lot of success building programs that help to foster this and creating pipelines doing it year after year. So two of those are, one is our administrative fellowship program and physician administrative fellowship program. So getting physicians who are just graduating from residency or chief resident or clinical fellowship, putting them, allowing them to continue their clinical. Obviously, early in your career, you still need to practice your clinical skills to hone them, but also allowing them to rotate through various administrative functions so that they're doing hands-on project work. They're meeting lots of people, building relationship capital. And then as we move forward in the program, those individuals can help to be junior mentors to other individuals. They can, continue to create bridges and help us even in recruitment. And so I think it really reinforces that relationship between the university and the organization just by building those networks. And also there's a leadership development program with our School of Medicine, which takes medical students going from first year to second year and offers them an opportunity to get a mentor and actually work in a place in the health system. And so getting that expert, mentor relationship really helps them. And it's amazing what they're able to achieve in just a summer's time. And then again, keeping that going by having bringbacks and giving them skills, even with leadership development, which is where I focus. We'll even do some leadership development with them, working on conflict skills, emotional intelligence, the Myers-Briggs personality inventory. And so I think kind of continuing in that vein of providing really strong mentorship and linking and fostering those, continuous relationships. And actually the industry gets a lot out of it as well. Sometimes they, what the students bring is very enriching. And they really become a part of the team. So it really becomes mutually beneficial and helps to create, a larger sense of harmony within the larger, community of the organization and the universities.
And I think for years, the industry separated physicians. They went to their own programs, right? Or they felt like they didn't need leadership development. And my organization actually put them all together in the last few years to grow their leadership skills together. Amazing how it felt. It built this teamwork and camaraderie and with an academic partner, there's more credibility. Physicians sort of want that, assurance, I think, that there is academic rigor with what we're doing, not just.
Two of the big benefits that they were more intangible and unintended benefits from that program that Mercy had was the networking. That people that were from different parts of the organization were able to meet colleagues and people that they could leverage in another part of the organization that they didn't even know, and that was what brought them together. And the other thing is that in healthcare, people tend to work in silos. I worked in my wards, I worked in my lab. They were able to see how all the parts fit together by meeting people from other parts of the organization. So a lot more organizational awareness, a lot more organizational connections and networking to help with problem solving. And those were
unintended positive outcomes from that type of a collaboration.
I have a question for our industry partners on Force from Baylor University. So as you're thinking about your development needs within industry, is it more like internal programs, certificates, formal programs like an MHSA or an MBA? What are the specific needs that you're all thinking about as you're kind of envisioning the needs of developing your leaders? Is it a portfolio? I'm just trying to get a sense from the academic side of what those needs are.
I think it's all that. So, a couple of examples. We were having challenges with getting a different skill set for pharmacy techs, for LPNs, things that aren't traditional four-year degrees. And we partnered with our local community college and offered 5 slots, free tuition to our own employees. And these are folks who were doing housekeeping jobs, scrub tech jobs, entry-level jobs that wanted to grow and develop. We had 60 applications for 5 slots. So that's just one example. So that's more of upskilling people to a longer-term career so that you can retain them. Our whole focus was trying to retain our employees from the beginning to the career. Certificates work beautifully for many things. Leadership development, IT skills, perfect for certification kind of things. And then I think the bachelor's and master's programs have their place too. We have plenty of folks who use tuition assistance to go back and complete their degree. And they get a more broad experience than just the ongoing continuing education they have in the system. So I think it's a portfolio, and portfolio might change from, every couple of years, depending on, what our industry situation is.
Yeah, one of the things that we are really focusing on right now, so we are looking at our entire competency model for leadership development. We restructured a year ago. We used to have programs, to your point about silos. Like we would have, the team leader program with one program, the leader and an executive leader were kind of handled by different teams, and we combined so that everything is under one team. And we're really looking at specifically what skills do individuals need at each level, and then how do we build that continuum and create a cohesive leadership journey. And so what we're realizing we're also kind of missing and need to add is the business skills. So really having that business acumen. So finance, understanding reimbursement models, how do organizations get reimbursed, understanding P&Ls, balancing, understanding the budget process, capital budget. So a lot of that are things that we're finding we want to build in more, even HR, understanding fundamentally sort of how do HR systems work, what's important, how do you leverage them? And some of that is about getting them internally and knowing who to contact and sort of how things work. But I think one of the things we've been looking at is also how do you train, what are some of the skill sets that everybody needs across the board, whether you're, a nurse leader who's training, for an executive nursing role or a chief nursing officer role or a medical director role, right? Or a physician's assistant or, somebody in corporate, like what are the skills that are the same for all of them? And then what are those role specific competencies and skills and knowledge that they need? So kind of figuring out what's the right model to really be able to deliver that across a very, large footprint of our organization. So those are just some things that we're focusing on. I think one of the things we did really well And we do have, finance courses and business courses and developing business cases, but I think kind of creating that more of that at earlier stages of the leadership pipeline and getting individual skills. Because the interpersonal skills, we know they're gonna need those, and we've been doing that and building that for many years. But I think it's sort of like adapting to the new challenges that we're all facing with sort of the larger healthcare environment, as well as digital and, the technology advances that are being made.
We have a question online from John Catalano, University of Michigan. How are your organizations preparing clinical and non-clinical leaders to understand, adopt, and diffuse AI and machine learning across the institution? To be continued.
That's a great
question. That's a great question, John. Any comments or thoughts or goals?
Can you repeat the question?
Yeah. How are your organizations preparing clinical and non-clinical leaders to understand, adopt, and diffuse AI and machine learning across the institution? I think Jeanne kind of mentioned.
Yeah, we're kind of early in. I mean, that everybody's, talking about AI. I think there's two things. One, AI in some sense is already with us. It has been with us. And I'll give an example, but then there are future, you want me to?
Yeah.
And I think there's just much, much more coming
In that world.
but a couple examples. We are piloting many things, and these are places too where we could use some assistance. So I think many in the industry are piloting things like voice recognition for charting. Right. So when we first started piloting that, the AI system behind it could not detect and made a biased assumption that the person in the room with the pediatric patient was the mother. Makes sense? Many instances it was not. It was the father. So we're piloting these things to learn, how do we adapt? We're piloting robots, drones for, medication delivery, all kinds of things. But I think really though it begins with our academic partners, because again, you all had to define some of this right off the get-go about how are we going to deal with students who are using AI to write their papers. And so we have tried to reach out to our academic partners to say, help us with some basics here. What do we need to think about? What do we need to consider as we move forward? But really, we're more in a pilot phase, I think, of trying to figure out how AI is going to work in our system.
Yeah, one of the things and this is not an area that I have any expertise in, but Northwell we do have an AI hub. It's Northwell specific, and any Northwell team members can go in there and use it. And it's really wonderful. It'll save all your, chats that you've done with it. And it really, powers a lot of the work that we do. It has guardrail, its own sort of guardrails on it. So I don't know if any of you have that within your organizations, but we have piloted courses, and we're going to continue to do that. We're going to have to figure out what individuals in all different, of the, professions are going to need to know and do, and then look at how do we educate them, as I was mentioning before, at all the various levels. So definitely has to be continued. There is a place for it. Will continue to be a place for it. So maybe next year we'll have better information.
So, I think a lot of us are still at the beginning of really looking at AI. And so our dean has put together a, sort of like a group of professors across all of the different college of health professions to think about not just how do we stop students from using AI, but how do we use AI as an effective tool within both clinical and non-clinical disciplines within the college, and how do we also then use that to enhance interprofessional education among all of the different programs too. And so we've only had our first meeting, so again, it's still early stages, but I think that a lot of our universities are thinking about, how do we incorporate AI? How do we, use it more effectively? How do we teach our students to use it in an effective way as well?
Yeah, go ahead. Well, we're just starting to wind down the meeting, and I was gonna ask if you haven't gotten a chance to speak. Feel free to share.
Well, no, I was just gonna say, so I used to be a teacher by trade and a high school teacher. And one of the things that we taught the kids was to use your resources, but to use your resources wisely. And so it's one of those things that AI is here to stay. It's not going anywhere. It's just going to evolve. And so it's kind of that education of let's not shy away from it. Let's figure out how to leverage it. We're fortunate enough in our organization to have a team that helps us. We have policies in place that, provide some guardrails, but I think that there is such a fear of it. And one of our coworkers wrote something recently about, the calculator people were fearful that like that was going to take away jobs of accounting. Like it's not going to do that, but it's going to be a tool for us to use. It's just kind of that piloting, figuring out what works. And so we've been fortunate enough to have a safe place to do that within AI for our organization. We have like our GME coordinators use it to do their schedules and, some things that you just maybe wouldn't think about in terms of ways to really leverage it. But I think that especially in terms of, that bridge to academia, kids are coming in with this information and we're the ones that have to kind of figure it out. And that's a role reversal to a degree because it's not really always the case. And so I think it's definitely going to be a challenge, but it's not something that we should be timid about. It's here to really help us. So, yeah.
Any other final comments? Anything? I'm looking at you, Sheena. Joyce, Ann, anything?
I'll just share one thing, I've enjoyed this conversation thoroughly. One thing I was talking about with Matt earlier, actually, was, we have administrative fellowships at most of our health systems. I oversee the fellowship at my system in New York. And I also oversee a number of pathway programs, internships for students, high school through to graduate level. And so how do we prepare those students to even consider careers in health administration? A lot of students I've worked with haven't even heard of administrative fellowships until they reach the master's level and they're like, oh, what's that, right? So how do we prepare them in advance and earlier to really consider these careers so that when they get to that level, they're already halfway prepared? And so one of the things we've done is create a pathway in that sense, create an administrative internship program so that students at the college level, at the high school level are already saying, oh, wow, I can do all these things that I want to do in healthcare that I didn't know. I didn't know that there was marketing in healthcare. I didn't know there was a thing called supply chain. I didn't know that if I want to study computer science, that can be applicable in healthcare. So just thinking about the ways that we can continue to partner with our academic institutions in creating those opportunities long term.
Yeah, that was right up my alley because we always had administrative interns and students who wanted to spend time in the clinical area. That's where they wanted to do their rotation. And I always said to them, you probably want to go over to materials management, purchasing, and again, as a healthcare administrator, learn broader what the health system is about, not just the clinical area.
Well, this has been a fantastic discussion. Thank you all for being a part of it. Thank you to our panelists, Jeannine and Jeannie. Thank you very much. And just a quick break, and then we'll get started with the competency model focus group at 9:30. Thank you, guys.